Good afternoon, everyone. So I'll be talking about our work, what we did on a robotized stereoscopic slit lamp and how we managed uh, teleophthalmic care for the cornea patients in the rural areas. So this work was done while I was at LV Prasad Eye Institute till about 2 months ago. So telemedicine is being increasingly used worldwide for providing healthcare services, and ophthalmology is very ideal for telemedicine for the simple reason that most of the pathologies are visible to inspection. In the sense, you can easily see your cornea, your retina is easily visible either on a slit lamp or, for that matter, on an ophthalmoscope. However, if it is a liver or a kidney, then you have to palpate, use ultrasound or something of that sort. So there are two types of telemedicine which we know of. One is offline store and forward. This is the most common teleophthalmology services which are being used at present. You simply take a fundus photograph of a diabetic retinopathy, then transmit it via email or directly over the internet, and then somebody at a remote position will uh, kind of see that image and then give you the feedback. Online systems are very few. On the other hand, like something like a Holter monitoring can be done at home. Radiology probably is using the telemedicine services the most at this moment of time. Most of the scans, quite a significant number of scans, which could be ultrasound or CT scans, MRI, being done in USA, are basically being seen and reported at in India at this point of time. We have developed a robotic slit lamp system for teleophthalmology, whereby an ophthalmologist can remotely control a slit lamp, and across distances, the patients, even from remote areas, can have easy access to global eye care. So at LVPI, we follow a pyramid system of eye care. You have a tertiary center, and then significant number of about 17 secondary centers, and then now the number is about 140 vision centers. So this is how the system would look like. The tertiary center, the center of excellence at Hyderabad, and this is the secondary level eye center, which is at Palvancha, about 330 kilometers from Hyderabad, where I used to visit once every 1 month. And then there would be 8 vision centers, which will be manned by a technician, vision technician, attached to one secondary center. The secondary center is manned on a regular basis by an ophthalmologist who can do the cataract surgery, but all the other services like cornea patients, retina patients would be referred to the tertiary care center. The primary vision technician at the vision center can do a refraction, but all other patients he will be referring to the secondary centers. So about 2 years ago, we started doing the cornea surgeries or the specialty services at the secondary center level. So I started doing corneal transplants or treating the cornea patients at the secondary center level, which, as I said, was about 300 kilometers from the main center. I used to go there for 2 days every month, do the surgery, see the patients, and then come back. So there was a problem as to how do we follow up these patients. So that's where the teleophthalmology and this particular teleophthalmic slit lamp comes into the picture. So it's a very regular upper Swami slit lamp which has been robotized by the stepper and servo motors in-house. The first one was done at Miami at Ophthalmic Biophysics Center. I was there for about a year for my research fellowship. So that's where it was developed, and then we have replicated the same process here at Hyderabad. All the functions of the slit lamps like magnification, illumination, XYZ movement, angle, rotation, slit height, even the filter change has been robotized. So you can, this is how the internal slit lamp would look like after the modification. And this is a patient who is at uh, Palvancha, about 330 kilometers away, and I can see that patient and examine that patient while I'm still at Hyderabad. This is how the screen would look like. You can have the screen either at your desktop or your laptop, or for that matter even on a mobile, and if you use these prismatic glasses, you can actually get a 3D stereoscopic image of the eye that you are examining. So at the moment we have about 10 such robotized slit lamp placed at various centers, and this is how it works. So as you see, there is nobody who is controlling the slit lamp. This slit lamp is being controlled by me while I am at a different location, voice, the volume. So you can talk to the
Yeah,
patient.
Srinivas, now we can hear you. Amma, kannu muskandi.
So you can talk to the patient
Amma,
and
kudi
patient
pakka,
can
amma.
follow your
Kudi pakka.
instructions, and
Amma, sagga chudni, amma.
you can give the instructions to the attendant who is over there, and even the medications also can be prescribed remotely. If the patient needs a surgery, you advise surgery. So the same thing you can have on your mobile also, and if you wear a view box like this, then you will get a 3D image. This is I mean the slit surgery or limbal cell transplant, which I did at that particular center because that was being done first time at that remote rural area. This was very well covered by the local media. This is a 7-year-old child who had a fungal infection and developed a fungal anterior corneal scar. So I did a DALC for that particular patient. The surgery was done at Hyderabad, but the patient visited Hyderabad only at 3 occasions. One was for the pre-op visit, then for the surgery because we needed GA for the surgery, which was not available at the secondary center, and then later for the suture removal. So 3 visits in total to Hyderabad. Rest all the follow-ups were done remotely by the teleophthalmic slit lamp. Now, this patient was shown to me on the teleophthalmic slit lamp by the local ophthalmologist who was at the secondary center. He thought probably this is an infection, but then when we took the history, the lady told us that she had a cooking oil which went into her eyes, and this was then treated as a with the AMG as a treated as a thermal burn. So these are few of the cases which we have done there. So this is a patient had a partial limbal stem cell deficiency, and this patient had a penetrating keratoplasty done. The follow-ups are being done from the slit lamp. This patient had done us. I did the DSEC for this particular patient, but followed up the patient from Hyderabad. And these are the numbers which show the specialty-wise cases which we have seen on the network, and these are the cornea cases which were seen on this particular system. Yes, the system is not foolproof as of now. I believe it's a little ahead of the time because one major problem is a good bandwidth. So you need a very good bandwidth because you're uploading videos. You're not just downloading a image, you're uploading videos. So you need a very good minimum 10 Mbps bandwidth for this kind of system to work. So that's why we have just placed it where we have a good internet connectivity by the local internet service providers. There are even weather related breakdowns because at some places the temperature goes as high as 50 degrees Celsius, and one of our the camera broke down because of that. Most of the parts which we are using for converting the slit lamps are imported, and it's not very easy to import them. We have used Amazon for importing, Alibaba for sometimes. So these are the issues involved. The next step, of course, is to integrate the interior segment and posterior segment. In the sense, we're trying to make this put in a lens into the system, by which we probably would be able to do the imaging for the posterior segment, the fundus also. We very much believe that teleophthalmology is a very good modality to help us take eye care to the remote rural population. So we are using it, one, to screen patients for eye ailments. Second, the patients which have been operated there, so we can follow them up. And as I showed the third case, sometimes the local ophthalmologists want to take a second opinion, so which we can provide. As of now, let me tell you that it is not a very economical model. We spend much more money on the slit lamp, making it, converting it, and on the internet facility than the value which we get out of it. But we believe with time, when the volumes will go high, this probably would become cost effective also. Thank you for your patient listening. And these are the people who have partnered on this. So this is the team from Bascom Palmer, and this is the team from LV Prasad.
Thank you, Dr.
And
Mukesh.
5 out of the 10 slit lamps which we used were donated by Appasamy. Thank you.